Welcome back to The Learning Curve, where we explore the art and science of medical education. I am your host, Irtaza Asar, and today we're tackling a skill that strikes fear into the hearts of many trainees, literally. EKG interpretation. Let's be honest, reading EKGs isn't just about memorizing waveforms or ticking off criteria from a checklist. It's about pattern recognition, clinical reasoning, and let's face it, confidence. But for far too long, EKG teaching has relied on static slides, endless lists, and lectures that just don't stick. So, how do we change that? How do we make EKGs more intuitive, engaging, and dare I say, fun? Whether you're an educator looking to increase your teaching game or a resident mentor guiding trainees, this episode is for you. And to help us break it all down, I'm joined by Dr. Justin Hacnik, who is a core faculty member at Christus Health Texas A&M residency program, and he is an expert in EKG education. He has been reshaping his own EKG curriculum, and he is going to share his expertise today with us. I couldn't be more happy to have him on. Justin, thank you so much for your time today, man.
Yeah, thank you for having me. Really looking forward to chatting today.
It's going to be a good time. And
Yeah.
I think a recurring theme that's been developing so far in the episodes, and it kind of just organically happened, is everybody tells me their hidden skill and I put them on the spot. So for people that don't know, Justin is a composer of EDM music. So if you ever run into him somewhere, he would definitely be open to doing any kind of like musical intro for you. Definitely at a conference, I think would be a great place to confront him about it. So I think that would be great.
Great. That's fantastic. Yeah, that's exactly what I want next time I'm at a conference. So looking forward to it.
He's really downplaying his skills. So I'm really hoping that if he's ever on stage, one of the guests like raises their hand and just says, "Hey, Justin, can you talk to us about EDM music?" He's an expert. So I think this is a great segue into EKGs now. Okay.
Perfect.
So Justin, let's talk about kind of the traditional methods with regards to EKG teaching. Talk to me about why you think that doesn't really work.
Yeah, I think EKG curriculum previously, when I first was in residency and kind of how it's traditionally taught is similar to other lecture formats where there's long form lectures that are 20, 30 minutes, sometimes even an hour long and encompasses a large amount of information. I don't think that that's typically how EKG knowledge is really passed on or developed for residents and learners in general. So in the past, those hour-long lectures may cover a long topic of ischemia or tachydysrhythmias. When I, was looking back at how to revamp that, because that for me personally wasn't an effective way to learn or acquire the skill, I really thought about, how is it practiced on shift, right? And on shift, it's we're multitasking and then someone hands us an EKG, or we're, doing something, a note, whatever, and someone hands you an EKG. And that kind of inspired, along with some other resources that are out there, to take that hour-long lecture and break it up into small micro teaching sessions that I think are more useful for residents, for medical students to acquire that knowledge. So instead of the hour-long lecture, it's a once a week at our weekly didactics and conference, a 5-10 minute tops lecture on a specific topic. And that goes over 6-8 weeks for that overarching theme of ischemia and infarcts. And each week is a different type of subtopic within there. And it's just one EKG with a clinical vignette. And it really gives residents that opportunity to kind of take bite-sized pieces and practice that skill more longitudinally rather than that single 1 hour lecture. So that was kind of the idea behind what I call Trace of EKG and how we treat our EKG curriculum at our program.
I really love that name, Trace of EKGs. It just kind of flows really well. But I think you brought up a really cool point, and this is something that I think I've struggled with as well. And I think a lot of other folks at different programs most likely probably are dealing with is this idea of the data dump, where basically you're sitting in lecture and you're getting a 2 hour lecture on EKGs. And I think that ends up just not being that effective. You're right. The transition to micro teaching and having these short segments where we can constantly reinforce to our learners about different topics with regards to EKGs, I think is going to end up being more valuable. So definitely, I want to deep dive into that curriculum in a little bit. So before we kind of dive into effective strategies for teaching EKG interpretation, I want to pose this question to you. What do you think makes EKGs fundamentally different from other clinical topics in terms of how they should be taught?
I think the biggest thing it makes them more difficult to teach and more difficult or more intimidating, I should say, for medical students or new residents is that they're not necessarily intuitive, right? They're almost kind of a different language in a sense of you have these tracings on a piece of paper, these squiggling lines, and what does that mean clinically for the patient? Because one EKG may have some subtle changes, and that could be the difference between a completely normal EKG or someone who needs to emergently go to the cath lab, or may impact which medication you're giving to that patient, where giving one medication could be harmful and one could be the right medications. I think that it's intimidating because it's not really that intuitive to new residents and medical students. In addition to that, there's a lot of information to cover. The further you go down the rabbit hole of EKGs, the more difficult it can seem. So there seems to be like a never ending, oh, well, look for this, look for this, look for this. That's why I think the idea of repetitive practice of it, of, spaced repetition, really allows you to reinforce skills, develop a foundation, and build upon that. I think having more of that spaced repetition gives people the opportunity to build those skills, and then it can become less intimidating.
That's a really great point, because what I found with a lot of younger learners is what they've struggled with is this idea of, okay, I have this EKG in front of me. I have to be able to interpret it at a high level, recognize a lot of these life-threatening issues, but then I also have to take a look at it in the clinical context of the patient I have. So trying to bridge those two separate islands of thought tends to be very challenging for them. I think there's a little bit of that fear factor that comes into it. I really liked how you brought up this idea of spaced repetition to try to tackle that problem, because I think the only way you can get over that fear, that anxiety that comes in with being handed an EKG, is just through spaced repetition and constantly having to redo it. I know in my program right now, a lot of the residents don't get to sign off on EKGs. So as an attending, when I became a newer attending at this facility, it was a little bit nerve-wracking because I was never put in that situation where I had to rapidly interpret an EKG and then at the same time make decisions off it. So as an attending, just kind of constantly getting those reps, I think really helped to desensitize me to that fear. And I think that's something that we can also do for our learners. One of the things that you highlighted just now was this idea of pattern recognition and trying to utilize pattern recognition to try to help our learners with EKGs. Since we're talking about effective strategies for teaching EKGs, can you talk to me about how we can use pattern recognition in our clinical practices to help our learners?
The biggest, or the first introduction that we teach even before residency in medical school, is just having a pattern of interpreting an EKG. So it goes back to, I think learned this in second or third year, the rate rhythm axis, interval segments, ischemia, or there's always some different variations of it. And I think having an approach similar to how people, or how you'd interpret a chest x-ray or the ABCs of trauma, having that regular approach helps develop those abilities to identify when something's normal and not normal. That first step in acquiring knowledge with, especially with EKGs, is knowing what normal looks like. And then once you have that foundation, you can identify this is abnormal. And then it's the practice, like we've been saying, or like I've mentioned, of this is abnormal. Is it a specific type of abnormal that fits a previous, lecture that we've seen, or previous EKGs that we've seen? So something that's as subtle as, maybe delta waves on an EKG. If you're not always looking at your PR segment, or, not looking for that, then that may be something that you might miss. So we really emphasize that early foundation of having a pattern of how you interpret EKGs, following that every single time. And then over time, it's almost second nature. It's not something that you're, front in your mind thinking, okay, well, let me calculate the rate. What's the rhythm? What's the intervals here? It's more of a intuitive process, but it starts at that foundation, and we build on that to introduce different abnormal findings that help with pattern recognition.
I think that's another really intuitive thing that I think sometimes tends to be forgotten by educators, including myself, is that EKGs generally are very visual things. So if we can teach visual patterns in that umbrella of pattern recognition, I think we can really simplify a lot of this for our learners, because then they know, hey, listen, STEMI, I'm looking for this kind of morphology. Brugada, I'm looking for this kind of morphology. Wolf Parkinson White, I'm looking for that triad of short PR, wide QRS, delta wave. And if I see that, that's the pattern that I've really built in my mind that I can bring back. To segue the conversation, since we talked about just pattern recognition and visual patterns, let's talk about case-based learning. How do you think that can play in terms of helping our learners understand and get a better grasp of EKGs?
Yeah, so with my lectures, or with our choice of EKG lectures, which I guess I can't even say they're all mine, because we've moved on to incorporating having third year senior residents who have been going through the kind of course over a couple of years. They're starting to take on some of the lectures as well, but all of the lectures start with a case of, this is a patient coming in for this. EKGs are important, but in a clinical context, right? So it's only another tool in our toolbox to help figure out what's going on with the patient. So that's really important. And a lot of times it's the foundation of each week's EKG that we go over. So we do a lot of case-based as the foundation for introducing EKGs. And I think that really reinforces the clinical scenario that may be more pertinent for those patients or for the residents to apply that EKG knowledge to.
Awesome. With regards to a trace of EKG and incorporating that micro learning and using that spaced repetition as well as case-based learning, what's been the feedback like from the residents when you've incorporated that into your curriculum?
Yeah, the feedback has been overwhelmingly positive. We thrive off of our residents' feedback and we are always making changes. But the feedback that we received after I introduced the curriculum has been overwhelmingly positive. We've had residents that feel more comfortable with EKGs. And then we've also been able to have younger, or I guess earlier learners would be the right word, first years, second years feel more comfortable with EKGs. So it's not this daunting responsibility as a third year going out to moonlight, now signing EKGs for the first time. It seems overwhelmingly that residents have appreciated it. The structure of it itself, and this may be a segue to a different question, but the structure of it is not just, 1 week, 1 week, 1 week, 1 week. It's several weeks of a overarching theme: ischemia and infarcts, tachycardias, arrhythmias, toxicology manifestations on the EKG. And over that time period, there's different things that we explore, different topics, different patterns that we look for. And then it's reinforced in small learning groups that are not just, third years with third years, interns with interns. They're collaborative groups with interns, second years, third years, faculty as well. And that really reinforces some of the ideas. And it's not just the 6 to 8 weeks that we went over, we bring stuff back from earlier on in the year. So even though you may be on an electrolytes abnormality block of the trace of EKG, on that small groups, the intern may be getting a patient that has the EKG that has positive for Scarbosa criteria. That just helps reinforce all of that. And some of the earlier learners may not get that, but that's okay. And it's an environment that's overwhelmingly supportive for those learners as well. So the feedback has been fantastic and, always looking to improve it as well. So in the last year, it was primarily me giving the lectures, and a lot of the third years felt that, they had given the opportunity, they'd like to kind of demonstrate their knowledge as well. So one of the every other week or every 2 or 3 weeks, one of our third years, our senior residents, they give one of the lectures as well. So, and that's their EKG that they're bringing, their case, their presentation. I think that really kind of reiterates the value of making that change in the curriculum.
Absolutely. And I've found that historically speaking, at least from my experience, whenever we've had incorporation of residents specifically into the curriculum with regards to teaching, like your example of having the resident essentially bringing in their own EKGs, I think that that becomes so valuable where now they're actively teaching. That ends up being a higher level of cognitive display also for the other learners as well. So I think that's actually really, really valuable. From your standpoint, let's talk about some other things that we can do to make EKGs even more engaging. I think a trace of EKGs is a fantastic example of some of the concepts that we've talked about with regards to spaced repetition, micro teaching. But what are your thoughts on gamification and competitive learning? Do you think that has also a place in terms of trying to teach EKGs at a high level?
Yeah, I think, in the right context, gamification and adding a competitiveness to it is useful. We actually incorporate EKGs in what we call sim wars. So it's sim wars. So we break out into teams. We have houses at our program, kind of after the Harry Potter houses. And it's basically a relay race. And sometimes part of during that relay race, your task maybe be to intubate a patient. And while you're intubating a patient, you may get handed an EKG and say, do I need to activate this to go to the cath lab? So things like that can, they're fun, they're exciting, they're different than sitting in a desk and then, doing, another 20-minute lecture. We really try to emphasize that, make it interesting, because those types of experiences, those types of learning environments, whether it be gamification or sim, and throwing in EKGs into sim, even if they're pretty straightforward EKGs, if it's a obvious anterior STEMI, that can add some laughs to the scenario, and that can actually reinforce it, because residents will say, oh, I remember that one time, I was doing this, and then that happens. I think it's very useful. There's probably other opportunities for that as well that we'll probably explore at a later time. But right now, that's kind of been the extent that we've incorporated it.
Awesome. I think I've heard of some other programs telling me some stories of making EKG escape rooms where there's different puzzles out there that they're trying to get their residents involved with and trying to have them try to figure out those puzzles and basically try to escape. So that's always been kind of an interesting thing. And I think gamification definitely has a place in terms of trying to make EKG curriculums even more engaging for our learners. I think that competitive aspect, specifically like with your Sim Wars example, I think can really go a long way to keep our learners engaged and focused, especially with regards to complicated topics. So, Justin, one of the other questions that I had for you, and I would love to get your insight on, is that it seems like real-time feedback is extremely important for learning EKGs. What are some effective ways to try to provide that immediate feedback on EKG interpretation to our learners?
Yeah, that's a great topic that I think is really interesting, and has been something that I'm kind of working on to continue to develop, especially the lectures themselves, right? So I can kind of confine myself to a 5 minute lecture for once a week at conference. And one of my favorite things is that when you create this kind of confined environment, that allows you to be more creative. It's kind of counterintuitive. I find that when you have limitations on yourself, you have to get more creative. So that exact idea of how do I get residents both engaged and not just kind of staring at the screen and kind of mumbling to themselves, and then also giving them real-time feedback. And I think using some of these online tools, whether it be like Mentimeter or Kahoot's, not necessarily for set up for, a 5 minute presentation, but things like that give residents an opportunity to really invest in just putting an answer out there, just typing in an answer, committing to something. It's anonymous. So there's not that potential embarrassment or shame, but or they have an investment and they have to commit to an answer of, what do I think is actually going on here? And if they get it right, they get it right. And there's going to be other facts on the slides that they're probably not going to know. And if they got it wrong, then I explain, where we went wrong. And I go through, it seems to be a lot of times when we use those types of things, there's probably two or three wrong answers that seem to be brought up on there commonly, if that makes sense. So I can kind of address those. But that gives real time feedback within the confinement of the 5 minute lecture. And that's just, at the beginning of the lecture, here's the QR code. The residents know when trace of EKG is coming on that there's going to be a QR code. They have it ready. And then the EKG with the clinical vignette pops up, and then we're ready to go. So I think that has been really useful and gets more engagement. And then they get the real time feedback as well.
That's an awesome thing that I think you guys are doing there. One thing I think about it from an educator standpoint is that if you're ever in a situation where you're teaching residents and there's a question and you notice that about 60, 70, 80% of the room is getting it wrong, that's an immediate kind of, hey, red light, let's stop for a second. Maybe there is a little bit of a cognitive lapse here that I need to work on. And again, even if I have a 5 minute block, I can try to come back later at a different session and try to tackle that issue because clearly a lot of residents are struggling with that concept. Because it's anonymous, there really isn't that shame or, hey, I'm trying to make you feel bad. This is, again, coming in from a good place and I'm trying to help you learn and grow. So that's awesome. Are there any AI or virtual platforms or AI driven EKG teaching tools that you've seen or you've heard of that you think could be really helpful for our learners?
Not that I've seen yet. I know AI has a growing role in even the interpretation of EKGs, which is kind of beyond the scope of this. I know, Dr. Steve Smith has been working on his Queen of Hearts. I think he's a part of that. And that's kind of a more EKG interpretation, developing those kind of subtle findings of ischemia. But from an education standpoint, I haven't necessarily seen anything. So it's definitely a place that could benefit from development there, but nothing that I've seen.
Just kind of shifting gears from AI to more of clinical medicine, bedside teaching and EKG incorporation. How do you think we can incorporate EKG teaching directly at the bedside and help our learners?
Yeah, this is something that our residents are always asking for, or more teaching on shift, right? And it's just kind of another thing as an attending to add on to the list. But I think it's really important, especially in education, if we're in academics, to take the time to go over whether it be a difficult patient or a treatment or a specific test that you want. EKGs are really unique in the sense that, like we've mentioned, you're sitting on shift, you're working on stuff, and someone hands you an EKG. You can look at your residents and see where they're at in their work, and if they're between notes or between picking up patients, hey, let's go over this EKG. walk me through how you would interpret it. It can be a completely normal EKG. I think that's just as important sometimes as an abnormal EKG. But that helps you gauge that thought process, and that's something I like to do on shift because even though I am teaching the lectures at conference each week, it allows me to kind of gauge individual residents and see where they're at, and if they need more assistance, then that's something I can, oh, hey, let's have you checked out, this resource? Have you checked out this resource? Like, why don't you come to our study group? We have a study group that it's pretty much a journal club, but for EKGs as well. We call it Brews and Cues, and we go through Dr. Amalmatu's books. And we've got faculty and residents and med students there, but it kind of gives me on shift the opportunity to gauge where they're at and see, hey, what are you struggling with? Are things kind of connecting? And if they're not, then that's okay. We can continue to work on that.
Absolutely. And I think Amol Matu is definitely one of the king of EKGs. So his resources are incredible out there for any learners that are
Absolutely.
looking to incorporate or just try to get better at EKGs. I would definitely recommend checking him out. And some of the things that you said just really resonated with me because those are things that I think I've also been trying to do with my learners. Anytime I get a weird or a kooky EKG, I try to find one of my seniors or my juniors and hand it to them and say, hey, I've got this gentleman here and this is the clinical context. Here's the EKG. The amount of Wellens type EKGs that I've had in the last couple of months, I think has been really helpful because there's a couple of residents that I'll catch off guard. And I know that's one of the more commonly board tested Roche review questions that frequently shows up. So they'll see it. And if I see them struggling, then I know that, okay, I'm going to probably reinforce this with them. And then I'm going to get them a second layer of reinforcement by sending them an article from maybe like Life in the Fast Lane or maybe one of Amal Matu's topics just to get them that secondary layer of further reinforcement and stuff. So that's really helpful, man. And that's a really great approach that you guys are taking, especially with the group sessions. Tell me more about the group sessions. How long have you guys been doing that and what's been the response to that?
Yeah, so our group sessions, they're once a month. Like I said, we call it Brews and Cues. And it's not necessarily, at a bar or something like that. It's just very similar to a journal club, how that may be at whether a faculty's house or a restaurant or something like that. We've been doing Brews and Cues now. This is going to be the fourth year. Each month we meet up. It's faculty, it's residents. We get our medical students involved as well. So it's fantastic for medical student engagement, recruitment. So each month when we have them coming there, they're more than welcome to be invited. And they obviously love the free food and love to hang out with everyone. But again, it's just, a list of randomly picked EKGs and we just go through them one by one. And that involves a little bit more resident engagement. It's not that required didactic session. We get a great turnout and we emphasize constantly, it's okay to get this wrong. It's okay to not know what's going on. And we're here. There's not an actual patient, and we're going to go over it. And you may be an intern now getting this wrong, but next year you're going to be better. And by the time you're a third year, you're going to be teaching the intern what it is. That has been a fantastic thing. I always look forward to it. We've always had really good feedback as well. So just another thing. We do more than just EKGs down here in Corpus Christi, but that's been my passion is EKG learning. And that's definitely something I enjoy. So.
That's really cool for somebody that's looking to try to engage their learners with EKGs more. I think that'd be a great idea for them to take back. So that's great. So Justin, as we're getting ready to wrap up, one of the questions that I usually ask at the end to my educators that I have on is, if I'm a first-time listener, what are the 3 key big takeaways that I can take away from this episode?
Yeah, so I would say the first one would be that EKGs and the teaching of EKGs is really unique compared to other things that we teach residents. So a 20-minute PowerPoint presentation on SCAPE or on a PE, those topics lend themselves to that type of format. But EKGs really don't, because that type of format and that long time period of time, that's not really how residents or how learners acquire the information. It's really a skill that you have to practice regularly and often. And by shortening that up into smaller time frames is something that can be really beneficial. So that would be the first thing, is that EKGs and the teaching of them really should be, in my opinion, occurring a shorter period of time and more frequently than probably already is happening. The second one would be to invite your residents to actually engage and practice this skill. So instead of lecturing them, have some kind of alternative, whether it be Mentimeter or some other resource that forces them to actually submit an answer. So they're not going to get those reps in. They're not going to build those muscles when it comes to EKG interpretation if they're just passively sitting there or kind of mumbling to a friend, oh, I think it's this. It can be completely anonymous, and it probably should be because it gives them the opportunity to freely get the answer right or wrong. And that gives them the rep that they need to get better and better. The third thing I would say would be to give your senior residents the opportunity to demonstrate their knowledge as well and to teach back to the interns or the second years. A lot of times when you're that level that you may not know what you don't know, or you may feel confident until you have to teach it to someone. So for us, getting that reinforcement by having our senior residents teach it as well, incorporating them in our curriculum is a really great way to make sure that they are also being engaged and that they're invested in the program as well. So I would say those would be my three things.
I think those are three incredible takeaways. Like Justin is saying, micro teaching is very, very valuable, especially in that short burst. You're going to get more engagement from residents as compared to those 2, 3, 4 hour long lectures where you're going through a cocktail of various EKG topics. And again, if you have them spaced out, you reinforce that learning every single week or every single month, and that ends up being more valuable for your learners. And again, you want to try to get buy-in from your residents. You want them engaged. So like Justin is recommending tools like Mentimeter that are out there where you really can put their feet to the fire and have them answer these questions in a safe space where even if they're wrong, hey, this is a learning moment for you so that the next time when you're on shift or in a clinical setting, you won't miss it. And like Justin is saying, let's get our senior learners involved because that's a time for them to showcase their knowledge. And if they have any gaps, we can try to address them right before they graduate. So putting them in that position to try to teach learners, I think is going to go a long way. So Justin, this has been an awesome episode. Thank you so much for the incredible knowledge that you've imparted with us. It's really helped us. And I think a trace of EKGs has really been more than just a trace, so to speak. I couldn't be more happy with this. And thank you so much for your time. Justin, is there anywhere on social media where folks can follow you or reach out to you for any questions?
I'm not on social media. My email is my first initial, J, and then last name, HACNIK at gmail.com. And I respond to that email daily. And then if not, through there, you can reach out to our program and they can get you in contact with me as well. It's at CCEMRP for the Christus program. So CCEMRP on Instagram, and that's our handle there. So.
Awesome. And what I'll do is I'll link the handle in the show notes. So for folks that are interested in trying to revamp their EKG curriculum, they can reach out to you and get your guidance and mentorship. So thank you so much, Justin, for your time. For all the listeners that are out there, I hope you guys enjoyed this episode. Let's keep the conversation going. What have you guys done to incorporate EKGs into your curriculum? I think this is a great and fascinating topic that we really can get better as educators. And Justin's been leading the forefront of this conversation. Let us know what you've been doing. Thank you guys for joining me for another episode of The Learning Curve. Looking forward to continuing the conversation.